A heart attack patient in Wisconsin was denied coverage for a device that would keep his heart beating because his insurer argued, a good argument here, Cenk, very good argument, that the device wasn't medically necessary. Because having your heart beat, not medically necessary, according to Blue Cross Blue Shield. Now, the 47-year-old Dan Saccomando needed this thing called the ZOLL LifeVest, which I've never heard of before. And this story is gonna be fun because I'm gonna have to say defibrillator multiple times, and I have to say it slowly. But basically what it is, it's a wearable defibrillator. And what it does is, let's say after you suffer a heart attack, your heart is weaker. And the likelihood of your heart just stopping, like it'll stop beating, that risk increases. And so you have to have a surgery to implement an internal defibrillate, geez, that thing, okay? The thing that you need to get your heart to beat. So there's a surgery you do to get that to happen, but having that surgery immediately after a heart attack is risky. So to bridge that gap, people can use what's referred to as the ZOLL LifeVest. However, the insurance company didn't want to cover it. And you might be wondering, well, I mean, how much could it possibly cost? A lot. We'll get to that in a minute. But first, Saccomando wore the life vest for more than 6 months in between his heart attack in May and his ICD surgery on December 6th. He says the device was costly, between $2,000 and $3,000 a month. So he spent anywhere between $12,000 to $18,000 out of pocket for that life vest just to stay alive. And this is what Democrats would call the wonderful free market system of choice, right?
Choice.
We've got so many choices.
You got a choice to die, you got a choice to live.
You
got so many choices.
You have the choice to either die or go into debt. Lots of choices. And keep in mind, he has insurance. Blue Cross, Blue Shield, that is his insurer. Now, the press reached out to the insurer to ask, like, yo, what's up with this? He's paying his premiums, he's paying his deductibles. Why are you not covering something that he needs to survive, which means it's medically necessary? While Anthem Blue Cross and Blue Shield does cover wearable cardioverter defibrillators,
nice,
in certain situations, medical research and current standards of care do not support the use of these devices following a heart attack. What? That's a lie. And they are not covered under Anthem's medical policy in cases such as this one. They also made clear that Medicare oftentimes doesn't provide coverage for it, and they are unfortunately correct about that, which is depressing to say the least, and Medicare should probably revisit that policy because it's a terrible one. But nonetheless, again, like, he needs this in case his heart stops beating before he gets the surgery he needs. And they just didn't want to provide the coverage for it.
Yep. All right, so I remember the Republicans saying, oh my God, if we have government-run healthcare, there's gonna be death panels.
Yeah, Chuck Grassley was one of those Republicans, actually.
Remember that? Here, let's go back. This is, I think, 2009.
There's some people that think it's a terrible problem that grandma's laying in the hospital bed with tubes in her, and think that there ought to be some government policy that enters into that. In the House bill, there's counseling for end of life.
That's it.
And from that standpoint, you have every right to fear. You shouldn't have counseling at the end of life. You ought to have counseling 20 years before you're going to die. We should not have a government program that determines you're going to pull the plug on grandma.
Okay, can I just jump in real quick? Because what Republicans tried to do in attempting to defeat the Affordable Care Act, remember that's back in 2009 when the Obama administration and Democrats were trying to pass it. They tried to make Americans think that there would be a government panel that would determine whether or not you should live or die based on whatever ailment you have. First of all, that was never a provision in the Affordable Care Act. The Affordable Care Act did include a provision, which they later scrapped, that would allow for patients to talk to their doctors about end-of-life care. So, the medical establishment is aware of what an individual wants done with their care at the end of life. But for someone like Chuck Grassley and Republicans and corporate Democrats, it's far better to have a death panel consisting of private insurers who get to decide whether you live or die.
Yeah, so Sarah Palin talked a lot about death panels. That's what Chuck Grassley was referring to in that clip. And back then it was a huge talking point for the Republicans. If you let the government run healthcare, they're gonna do death panels that decide whether you live or die. Well, Anthem Blue Cross clearly has a death panel. They decide, okay, no, if you need that defibrillator, you're not gonna get it, so you're on the die list, and some others might be on the live list, but they have a death panel. But when private insurance has it, and coincidentally, they then send huge checks to people like Chuck Grassley and corporate Democrats and corporate Republicans. All of a sudden, Chuck Grassley can't find a way to care about death panels. Doesn't care at all. He's like, oh, Anthem, you're making good money, profits, and you're giving me a tiny piece, a taste of that? Do the death panel, love it. Okay, just be honest. You're never gonna, but they're politicians, they're all crooks. They're never gonna be honest. Don't believe the media. The media tells you they're honorable. Chuck Grassley's a piece of dirt. He's the least honorable man I've ever met in my life. Lies to you about how the government's gonna kill you, when in fact, Social Security and Medicare are the most popular programs in this country because they work, okay? And Medicaid is intensely popular. They work, they're government programs, Medicare and Medicaid, that oftentimes save your life. Whereas, how does private insurance make money? Does anybody ever tell you this? Certainly no one in mainstream media would ever tell you this, right? Because they're all advertisers. So
they make money by offering the best product and the best coverage, and they compete with one another in the free marketplace. That's the way it works, right?
Oh yeah, I mean, if you listen to Anderson Cooper and Jake Tapper and people who write at the New York Times.
Best healthcare in the world.
Oh, we're number one. Okay, absurd junk. We're actually number 37 in healthcare. Life expectancy is a disaster in this country. Now, why do we rank lower than all the Northern European countries and Japan and Canada and all of these other places? Well, because they have universal health care and we don't. We allow private corporations to profit off of medical treatment, and then you know how they profit? By you dying. And that's literal, that's literal. So let me explain it real quick. Revenue is the premiums and deductibles, et cetera, that you pay. So they have an incentive to try charge you as much as humanly possible. And the government doesn't protect you at all. So, I mean, it's so absurd. Now the good drug companies go, oh yeah, I can charge anything I want, and Medicare can't even negotiate. Well, that's not even capitalism, right? They're like, yeah, I know. I bribed all these dirty politicians like Chuck Grassley, Sarah Palin. And by the way, huge chunk of the Democratic Party, including Joe Biden, okay? Including Nancy Pelosi, including Chuck Schumer. They all got bribed, and then they go, oh, golly gee, we're not gonna negotiate drug prices with drug companies. When it comes to health insurance companies, we're gonna say, oh, did they let you die for a profit? Oh, we missed it, golly gee. So I told you about their revenue, they're driving up the prices. What's their cost? Their cost is treatment for you. So do you get, logically as a business, they have to deny you as much treatment as possible that they can get away with without government regulating them, which is almost everything, right? Because government is in their back pocket. They're gonna deny you, deny, because you're their cost. But if you die, is that a cost to them? No, they saved a lot of money if you die, because then they don't have to treat you anymore. So this is the sick system that we have in America. No other developed country has it, none. All of them have universal health care. They don't let you die in the street like we do, okay?
I mean, countries that we provide tens of billions of dollars in military aid for have universal health care. Israel has universal health care. I mean, it's insane. We're providing foreign aid to countries that have better health care than we have here in the United States.
And then when you say, well, why can't we have at least as good a health care as Israel or Canada or somewhere else? They go, how are you gonna pay for that? Well, then how am I paying for aid to Israel and the United Kingdom or wherever else I'm sending the money to? What do you mean, how am I gonna pay for that? So, and by the way, you know what it costs on average for all of those countries, which is every developed country? It costs half of what we pay for our healthcare. And then liars, grotesque, sick liars like Jake Tapper go on CNN and go, how are you gonna pay for that? All you progressives trying to help people. I look down my nose at you. Oh, next is an ad by an insurance company and a drug company.
Yeah, I'd be careful, Tapper. I'd be careful. They moved you to primetime. You didn't do so well. that CNN provided health insurance might not be around for too long.
Yeah.
Anyway.
He failed at 9 o'clock because nobody likes corporate stooges. They got promoted by a corporate stooge to be a corporate stooge at 9 o'clock. It didn't work. His ratings were terrible. They moved him back to 4 o'clock. But my favorite part of that story was, like, oh, Jake wanted to move back to 4 o'clock.
He wanted to make sure to spend time with family.
Oh, yeah. No, people love that work at cable news. They love turning down millions of dollars.
Totally,
okay,
that's what they're known for.
At 9 o'clock, do you have any idea how much more he would have gotten paid? But oh no, I want to spend time with Willie at dinner. Sure you do, sure you do. No, you suck. Nobody's interested in you. That's why you're in the situation that you're in now.
All right, I feel a little sodium depleted today, but you're bringing it, Cenk. You're bringing it.
Yeah, I got plenty of salt.
Thanks for watching The Young Turks. Really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR. So those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.